Hello everyone, my name is Rupal. I am a registered nurse. I have worked for several years in hospice and palliative care, meeting hundreds of families throughout this journey and learning so much along the way. My purpose for creating these videos is to help you understand what palliative care is, how it helps, and why you should ask for it when the time is right. I am not paid by anyone. This is simply to educate and guide families who need support. So let's learn it together. Today we are talking about the stigma of palliative care and how to overcome it. The moment many people hear the word palliative, they automatically think about hospice because ideally, usually they go together. And the moment they think of hospice, their mind shuts down. They freeze. They think about death. They think about giving up. They think about the end. Because of that misunderstanding, they stop listening. No matter what you say after that, it just doesn't get through. They didn't even give palliative care a chance to be explained. This happens very commonly, believe me or not. And honestly, it breaks my heart because families who are already overwhelmed are not given the comfort and support that they qualify for. They are carrying the burden alone when help is available. So let's clear this up today. Palliative care and hospice care are not the same. Yes, the same companies may provide both services, but the focus for both of these services are on comfort, one focus. But the purpose and timing for both services are different. Even though the main purpose is comfort, the timing and how to serve or what to serve is different. Palliative care is specialty service you can receive while you are getting treatments to fight the disease. If you watched my first episode, you already know by now that you do not need to be dying to receive palliative care. You do not need to stop your current treatment. Palliative care is meant to ease the difficult symptoms that are caused by your illness and the treatments you are going through. You're already fighting so hard. You deserve comfort more than a few better days while you fight. Palliative care helps with that. What does it help with? Pain, nausea and vomiting, anxiety and fear, shortness of breath, tiredness and fatigue, poor appetite and weight loss, difficulty sleeping, emotional draining, emotional stress. Basically, it helps with the side effects from treatments like chemo, radiation, or per se, really any draining treatment, any difficult treatments, any long-term treatments. This service, many of you do not know, but it is covered by most insurances. Just like any other specialty consultant, if your insurance covers a cardiology, a pulmonology, or an oncology, it will cover palliative care. The primary care doctor or any doctor who is treating the patient, you or your family, including oncologist, cardiologist, pulmonologist, kidney specialist, liver specialist, hospital doctors, can write an order for palliative care consult. You can ask for it. You do not need to wait until someone is offering you, okay? So the most important message that I have is asking for palliative care does not mean giving up. In fact, it means you want to live better and continue the fight with more strength. Palliative care should be seen as extra help that you deserve, most like a specialist helps a specific part of the body disease. A palliative specialist helps your comfort in daily living. So there is no harm in asking for a consultation, right? What's the worst that can happen when you ask to your doctor? If you do not qualify, you will learn what is available and you continue with your usual care. Nothing is changing. You never know when the health situation changes or somebody you know can be in need of that and you or they might qualify. And that time you would be the advocate for them. The best case scenario, if you qualify, you get a team that supports you and make sure that your symptoms are under control and making you start feeling better. So let's remove the stigma. Let's normalize asking for comfort. Let's stop waiting for suffering to get worse. In our next episode, we will talk about who can receive palliative care. You will understand exactly when to ask and how to explain your needs to your doctor. So, thank you for joining me today. See you in the next episode. Bye-bye.